Welcome everyone. Today we're going to talk about one of the most common diagnostic tools you will use every single day in clinical practice, the complete blood count or CBC. Think of it as the body's report card. It doesn't tell you everything, but it gives you a snapshot of three major systems all at once. By the end of this talk, you'll know how to look at a CBC not as a list of numbers to memorize, but as a conversation the patient's body is having with you. Love the CBC because with one blood draw, we get a window into three completely different body systems. We can screen for anemia, infection, inflammation, cancer, and bleeding problems all at once. It's one of the highest yield tests you can run, and it's often the first thing that tells you which direction to go with a case. CBC is really three mini reports bundled into one. Red blood cells are your oxygen delivery trucks. White blood cells are your immune defense team. And platelets are your emergency repair crew for blood vessels. When you look at a CBC, your first job is to ask, which of these three systems is abnormal and why? That's the systems approach. We're not memorizing values. We're asking what the body is doing and why. Let's start with red blood cells. Their one job is to carry oxygen. The three numbers we use to evaluate them, PCV, hemoglobin, and RBC count, all basically answer the same question. Is there enough oxygen getting to the tissues? These three values almost always move together. When they're all low, that's anemia. When they're all high, that might be dehydration or, rarely, true polycythemia. The PCV is often your quickest, most reliable number. A simple spin of a hematocrit tube gives you that all in minutes. When you see anemia, don't just write anemia and move on. Ask yourself three questions. First, is the bone marrow doing its job? A regenerative anemia means the marrow is cranking out new cells, which usually means something outside the marrow is the problem, like bleeding or red cell destruction. A non-regenerative anemia means the marrow itself isn't responding well, which points us toward chronic disease, bone marrow pathology, or certain toxins. The reticulocyte count, those young immature red cells, is your window into marrow activity. High reticulocytes, the marrow is working hard. Fewer none, the marrow is quiet. Let's talk about white blood cells. There are 5 types, and instead of memorizing them, think of them as a team with different specialties. Neutrophils are your first responders. They rush to any site of infection or inflammation. Lymphocytes are your long-term strategic thinkers. They build immune memory. Monocytes are the cleanup crew, especially important in chronic disease. Eosinophils show up for parasites and allergic conditions. And basophils, they're that team member who rarely shows up, but gets everybody's attention when they do. On a CBC, we look at the total white cell count and the breakdown, the differential, to understand what's driving the response. You look at the white cell picture, you're looking for patterns, not single numbers. A high neutrophil count with a left shift, meaning immature band neutrophils are showing up, tells you the bone marrow is being pushed hard to respond to something urgent, like a serious infection. A stress leukogram, high neutrophils, low lymphocytes, mildly elevated monocytes, is incredibly common and just tells you the patient is stressed or on steroids. Recognizing that pattern prevents you from overcalling an infection. Context is everything. Platelets are small. They're anucleate, meaning they don't have a nucleus, but they punch way above their weight. When a blood vessel is injured, platelets rush to the scene and form a temporary plug. When the platelet count drops very low, below about 30,000 in dogs, you can start seeing spontaneous bleeding, bruising, petechiae on the gums, nosebleeds. One really important pearl: Always look at a blood smear when you have a low platelet count. Platelets love to clump together during blood collection, and that clumping can make the count look artificially low. A smear will show you those clumps and save you a false alarm. Here's a simple workflow that will serve you for your entire career. Go through the CBC systematically. Red cells first, then white cells, then platelets. Then step back and ask, what one disease process could explain everything I'm seeing? For example, low red cells, low white cells, low platelets all at once. Think pancytopenia and point your work up toward bone marrow disease or serious systemic illness. A CBC becomes powerful not in isolation, but when you combine it with the clinical picture. The numbers don't make the diagnosis. You do. Bring it home. The CBC is 3 reports in one. Red cells, are we delivering oxygen? White cells, how is the immune system responding and what kind of process is driving it? Platelets, is the primary clot forming system intact? Use a systematic workflow every time so you don't miss things. And always tie those numbers back to the animal in front of you. A number out of range is just a clue. You're the detective. Question 1. You've got a young dog, obviously anemic. PCV of 18 is quite low, but the reticulocyte count is high. What does that tell you about the bone marrow? And given that the marrow is working hard, where is the problem coming from? Correct. This is regenerative anemia. The marrow is doing its job, which means the problem is upstream of the marrow. Either blood is leaving the body or it's being destroyed inside the body. On the smear, spherocytes point strongly toward immune-mediated hemolytic anemia. Schistocytes, fragmented red cells, might suggest mechanical destruction. And if there's a positive saline agglutination test, that's a big flag for immune-mediated hemolytic anemia. The reticulocyte count alone told us which direction to look. Case, here's a really practical one. You're going to see this pattern constantly in clinical practice. Look at those numbers. High total WBC, lots of neutrophils, barely any lymphocytes, elevated monocytes. The cat's on a steroid. What's your interpretation? This is a stress leukogram, or more precisely, a glucocorticoid leukogram, because it's driven by the prednisolone the cat is already receiving. Steroids push neutrophils out of their marginal pool in the vessels and into circulation. They also cause lymphocytes to redistribute away from blood. So you get this classic pattern: high neutrophils, low lymphocytes, mildly elevated monocytes. This is one of the most commonly misinterpreted CBC findings. Do not start antibiotics for this. Always ask, what drugs is this patient on? Next question. This one's a bit of a trick, and it's one of the most important lessons in clinical pathology. Platelet count of 18,000 is critically low on paper, but the dog looks completely normal. Before you panic and start treatment, what do you need to do? Before you do anything else, look at a blood smear. Platelet clumping is extremely common, especially in cats, and it causes the analyzer to undercount because it can't recognize the clumps as individual platelets. If you see big clumps of platelets at the feathered edge of the smear, that automated number is not accurate. This saves patients from unnecessary treatment and saves you from a diagnostic rabbit hole. The smear is always your friend. It's the original quality control check.